Welcome also to all of you people. This is a really amazing moment in history, and I'm all glad that we're all here together. Our panelists are ready to engage, share some information with you, but mostly we want to hear from you. And this is an amazing time we're all living through, and we're glad that we're all together doing it together somehow. Melissa, you want to say hi from the library?
Oh, I'd love to. I can do that.
Okay.
Hi everyone, my name is Melissa Haas. I'm the Director of Development and Programming here at the library, and I'm just so pleased that everyone can be here, that we can make this happen. Nancy reached out to me and our director, Erich Reed, and said, we have this idea for this community forum, and please come on in. And you know, we found that in these times, we are so happy as a library to be offering this space to hold for conversations and for information and for our community. We like to think of ourselves as the living room in Southwest Harbor, and I think this is a perfect kind of conversation to have in Los Angeles. So thank you to all of you for being here. If anyone needs the facilities, they are down the hall, and before you get to the door to exit, don't go out that door. Go a little bit to the left, and it's right back there. We have one bathroom there, and same with if you need to leave quickly in case of an emergency, that's an exit. And then same back way through towards the Village Street.
Great. Welcome, everyone. My name is Jim Vallette. I live on Seawall Road here in Southwest Harbor. It's really great to see everybody here and online. This forum, it brings together 4 distinguished panelists. We're so happy to have you all here in Southwest Harbor. On the left is our Harbor Region State Representative Gary Freedman. To my immediate right is our Southwest Harbor Representative Holly Eaton, Dr. Mark Kandich, MDI Hospital, and Katie Friedman. This forum aims to explore how changes in federal funding impact Maine's legislative initiatives, healthcare systems, and efforts to address food insecurity. Our objectives here are to promote a community understanding and engagement on these critical issues, to clarify the impact of shifting federal funding on Maine's communities and state initiatives, and provide inspiration and share opportunities with each other for citizen action. Our community is extremely engaged, as you can see from this room and online, in this unique moment in our history. There are 4 ways that people can participate through questions and brief comments. Online, you can add questions and comments to the chat, which I will be helped with by Kate. There'll also be an opportunity to speak online, as well as here in person. If you have questions and you prefer to write them down, please give them to Alex or Nancy, and they'll bring it to me, and I'll try to synthesize some of these questions. And also, they'll be passing the microphone after the presentations. So we'll mix all that in here. And just to get going, I'll introduce all 4 of them more completely. On the left, Gary Freedman is a Maine State Representative known for his advocacy on community development and public funding initiatives. He's been instrumental in shaping policies that respond to changing federal priorities with a focus on sustainable economic growth and social services. To Gary's left is Katie Freedman with Healthy Acadia. Katie leads food security initiatives there, a nonprofit organization we know well. She designs and implements innovative programs to tackle food insecurity, drawing on cross-sector partnerships and adaptive strategies in response to changes in funding streams. Dr. Mark Kandich is an orthopedic specialist at MDI Hospital with expertise in regenerative medicine. Thanks to his 45 years of delivering health care, he has a unique perspective on the evolution of healthcare on MDI. And finally, we have Representative Holly Eaton, who serves as our representative, as I mentioned, here in Southwest Harbor, Tremont, and other outer island areas. Holly is a champion of education, workforce development, and equitable access to resources. Her experience includes navigating legislative changes and fostering collaborations to maximize the impact of federal and state funding. So thanks again to our panelists, and we'll start with Gary and work our way down. Thank you.
Thanks, Jim. Should I use the microphone?
Yes, please.
Yeah, okay. Well, first I just want to thank the Southwest Harbor Library for hosting this forum and all of you for coming out. I think this is a really challenging time for many of us. What's happening nationally, and what I'm trying to do is look at how the Republican administration's policies are going to hit us in Maine and what we can do about it. We're 1 week into the federal government shutdown. There are 3 things that I'd like to share with you tonight. 1, Democratic legislators like myself are facing an extreme, radical Republican Party that's out to destroy the existing federal government. They believe in authoritarian rule, and they're working hard to consolidate power as completely and thoroughly as possible in order to destroy our democracy. That's why I'm organizing these forums throughout my district, and this is the first one on the island. Holly and I were in a forum in Ellsworth a month ago, and it was very well received. Number 2, the Maine House of Representatives enjoys a very slim majority that allows us to pass bills to protect the most vulnerable in our state. Our biggest challenge is, frankly, our governor, who is opposed to raising taxes on the wealthy. And number 3, I believe the ultimate strength of our government, local, state, national, lies with the people. I'm organizing these forums to encourage community conversations about the most pressing issues, and I'm really looking forward to the discussion portion of this program tonight. So, what do we do now? Federal cuts to health care, food assistance, and education will hit our state hard. Tens of thousands of Maine families, thousands of our friends and neighbors will be thrown off their health coverage. Rural health care clinics and hospitals may close. Tens of thousands of Maine people, thousands in Hancock County, will lose access to food. Immigration and Customs Enforcement, ICE, will continue snatching people off our streets, from their workplaces, from schools and courthouses. I believe we must do everything we can to prevent the worst from happening in Maine. That means passing bills to fund hospitals, the SNAP program, education, and protections for our citizens from abuses by federal authorities. I serve on the Joint Standing Committee on Taxation. We've worked hard on 3 bills written to provide hundreds of millions of dollars in revenue. The first is a 1% increase in the corporate income tax on companies making more than $3.5 million in profit annually. Just 1% we're asking for them to pay their fair share of the cost of doing business in Maine. We have a bill to add 2% tax on households making more than $1 million a year. This isn't a wealth tax, it's on people who have incomes above $1 million. That bill is written to guarantee continual state funding for education. And the third bill is a new income tax bracket system, where right now we have just 3. LePage got rid of the top tax bracket, and those 3 brackets range from 5.9 to 7.45%. We want to lower the taxes for low income and working families, and then add 2 new brackets above $250,000 and $500,000. These 3 bills would generate about $150 million a year. That's a very small portion of what the wealthy are getting back from the big beautiful bill tax cuts. The biggest hurdle to passing these is our governor. She's made a promise, and when she made a promise when she first ran 7 years ago, that she would not raise taxes, and she's standing in the way of these bills. There's information you can pick up, or maybe you've already gotten it here, about these bills, so you can communicate your concerns directly to the Plain House. And I've given you 3 handouts. One is what the cuts to Obamacare subsidies would mean for different families. And it's a little detailed, but it's worth reading because it shows how anyone who's on the Affordable Care Act is going to be paying thousands of dollars more per year. It's probably going to force those people off of Obamacare, and they'll either go uncovered, and they make too much for main care. So it's that loss is going to hit our hospitals hard and hit those families hard. Very concerned about that. And then there's, I have another handout that kind of summarizes the impacts of the big beautiful bill. And finally, I'm passing out one of my newsletter articles. And on the back of that one, it has the 3 bills that I just mentioned. It also talks about a bill to protect the state and local police forces from having to cooperate with ICE. And it has how you contact the government. So I hope you'll take those and study them and take them back.
I'm going to get in there.
Look forward to Q&A at the end of this.
Thank you.
Thank you, everyone, for having me. I'm the Community Health and Food Programs Director at Healthy Acadia. I've been with the organization since the mid-2000s. We're a community health organization primarily serving Hancock and Washington Counties, but also with some programming across the state. We're a team of over 80 team members working in collaboration with community members and partners on a broad range of programs and services spanning 8 focus areas. Those are strong beginnings, healthy aging, healthy and active environments, health promotion and management, substance prevention and recovery, healthy food for all, basic needs, and health equity. Tonight, my focus will be on our Healthy Food for All area, which serves to address food insecurity and improve nutrition for individuals and families across the region. We are committed to ensuring that all people have access to nutritious, affordable food, and to make the healthy choice the easy choice. So as I said, I've been with the organization for over 15 years, and I've seen shifts in the funding landscape and the conversations around public health and nutrition policy at state and federal levels over the years, and can certainly say that what we are witnessing now is an unprecedented change in how federal funding is allocated, as well as just the general conversation around these topics. And these changes are affecting the emergency food system at all levels. Individuals are going to be receiving less support from the government and will be more reliant on emergency food providers. At the same time, less food is flowing to those food pantries and food banks, and the food that they purchase is getting more expensive. Supportive nonprofits like Healthy Acadia and many others that work to improve systems and increase the availability of healthy food to these venues are seeing fewer opportunities to receive federal funding to make this work possible. These dynamics are affecting food security organizations all across our state, including those right here in Southwest Harbor, like Common Good and the Westside Food Pantry. There are a few program cuts that I wanted to highlight. I want to go into some detail to give you guys some information. Hopefully it won't be too much. So first, back in March, the USDA announced the termination of the Local Food Purchasing Assistance Program, or LFPA. This, the cut funding represents $1.25 million that would have been distributed in Maine. These funds had previously made it possible for organizations to purchase food from 75 Maine farms and distribute that produce directly to over 200 Maine emergency food providers. The Emergency Food Assistance Program, or TFAP, was cut by $500 million in March. That program delivers millions of pounds of U.S. grown food to food banks across the country, including Good Shepherd Food Bank here in Maine. Good Shepherd is receiving 250,000 fewer pounds of food per month due to those cuts in the TFAP program. Of particular concern to us at Healthy Acadia is the fact that the SNAP Ed program was defunded in the budget reconciliation bill, the so-called Big Beautiful Bill. SNAP Ed helped people of all ages to shop, cook, and eat healthfully on a budget. And we were the local implementing partner in Hancock and Washington Counties for the past 12 years, employing 4 amazing nutrition educators and reaching over 2,000 people annually. Despite our and many others' best efforts to advocate for the continuation of that program, it was eliminated as of October 1st, and we're in the process of winding it down over the next few months. As you're probably aware, that bill also included significant changes to the SNAP program that will result in millions of people losing access to food benefits. Those changes include the expansion of work requirements, dramatically limiting waivers, work requirement waivers for areas that have a particularly elevated unemployment, limiting simplifications that made it easier for people who were receiving heating assistance to also receive food assistance, and just bogging down the process and taking away these levers that made it easier for people to access benefits. And ending SNAP eligibility for many immigrants who are living lawfully in the U.S. and have been granted humanitarian protection by the federal government, including refugees, people granted asylum, and certain survivors of domestic violence and sex trafficking. In addition to those direct cuts to major food assistance programs, I also want to highlight how grant programs within the USDA and other agencies are being impacted. A lot of this is something that you wouldn't know if you're not involved in writing federal grants, like we are at Healthy Acadia and many other organizations. So in some cases, grant-funded initiatives are simply being eliminated, some of which are midway through implementation. Funding's just being pulled from organizations that had thought they had 3-5 more years of implementation on a grant. In other cases, we've seen grants being released with only a week until the deadline, when normally applicants would have at least 6 weeks to put in a complicated federal grant proposal. And we at Healthy Acadia have directly experienced the grant review process being paused indefinitely with no communication to applicants about when we might expect our proposals to be reviewed. Federal agencies are also issuing new guidance to grantees that they are required to follow or risk losing their funds. This guidance includes restrictions on diversity, equity, and inclusion, or DEI initiatives, and restrictions on any work referencing or supporting transgender individuals, among many other things. Some federal agencies have even released guidance indicating that organizations will not be eligible for funding if they have engaged in any of the newly prohibited activities in the past, regardless of their current priorities and initiatives. So that feels heavy to me, all of that, and but I do want to end on a note of optimism because there is a lot going on within Maine and nationwide. So I'd like to conclude with a few examples. So after the cuts to the LFPA program that I mentioned at the beginning, several organizations, including Healthy Acadia, who had been recipients of that funding, we began talking about what we could do to ensure that the farmers who were depending on that income and the food pantries that really needed the produce, how we could help make sure that they weren't left in the lurch. From those conversations arose the Farm to Neighbor campaign, which is a statewide effort led by Peak Season Produce to raise funds to replace what was lost. Farm to Neighbor's mission is to expand local food access to vulnerable people, support underserved and BIPOC farmers, and contribute to a resilient agricultural economy. The effort has already raised well over $100,000. And if you're interested in learning more or supporting that effort, the website is farm2neighbormaine.org. There's also a group of food systems leaders being convened by MOFGA, the Maine Organic Farmers and Gardeners Association, that has been meeting since March to discuss how these funding shifts are impacting our work, to share information with each other, to collectively advocate with our federal delegation, and to strategize innovative ways to build a stronger food system without federal support, or with significantly less federal support. As the SNAP Ed program has been defunded, Healthy Acadia is launching a campaign to support continuing nutrition education across our communities. We hope to raise $200,000 for the coming year, which represents about half of our budget for that work previously. Healthy Acadia and other partners will also begin implementing SNAP outreach beginning this month. That work involves educating people who may be eligible for SNAP about the program, including the recent changes, in order to encourage people to sign up and to ease the enrollment process. And then finally, there are two upcoming opportunities that I'm aware of that I wanted to share to learn more. Tomorrow on Maine Calling, which is 11 a.m. on Maine Public, the topic will be food insecurity, including the impacts of federal funding cuts, so be sure to tune into that, either on air or online. And then on October 20th, Sarah Alexander, who's the executive director of MOFGA, will be speaking at Beach Hill Farm. That's from 4:30 to 5:45, and she'll be talking about the impacts of federal funding changes on farmers and eaters in Maine. So thanks again for having me. I really look forward to this conversation and the wonderful company that we're in, and I'm happy to answer your questions as we move on.
Thank you. So I'm Mark Kandich, and I've been practicing medicine in my hometown, Bar Harbor, for almost 44 years. First I was in private practice, and then I became an employee of MDI Hospital. In this forum, I'm going to be representing my own opinions and not speaking as a representative of the hospital. But I can certainly say that although I don't know specifics about how exactly the proposed cuts will affect our hospital and clinics, I am certain that it will be harmful. So, to make my points, I want to recall some experiences that I've had during my time as a clinician here on the island. It's a few events that I think sort of together form a bit of a timeline and a trend, and illustrate a kind of a trend or a trajectory. And this trajectory reflects a gradual decrease or abandonment of the government's role as funder and sponsor of healthcare services in America, and a corresponding expansion of the role of the insurance industry, which has increasingly inserted itself between the patient and the provider. And so with that in mind, the prospect of more funding reductions from the government doesn't really seem to me like a major departure from the trend. But as I'll point out, there's one exception to that that's really important. Now the first, and I'll go really quickly through this because I think I may be a little off topic here, but the first milestone I recall really important was when I first began practicing. This was the time when the state mental hospitals in Maine were in decline. They were downsized drastically during the 1970s. And that was because the conservative Longley administration wanted to cut costs, and they made common cause at the time with some advocacy groups like NAMI, N-A-M-I, who mistakenly believed that residential treatment for people with serious mental illness is unnecessary. In any case, the private hospitals that we have for psychiatric care just don't fill that need, and there has been an increased amount of need for psychiatric services last few years, to the extent that it is routine now for seriously mentally ill people to languish for days or even weeks in emergency rooms all across the state while waiting to be admitted to a psychiatric hospital. And I think this is something that really deserves a lot more outrage and attention than it does get. The second development that in my career was the advent of managed care, the type of health insurance that now is routine, but it didn't exist at that time. The companies realized that they could use the power of the purse to control over providers and patients, so that they would be responsible for managing people's care rather than just paying for it. And this had a tremendous amount of effect on how healthcare is delivered and funded in the state. And now, just adding on to that is the healthcare industry is now kind of leading, I guess by default, what we are trying to accomplish in terms of healthcare reform nationally. Is, I think a whole lot of that is being led by the industry itself. The third, so we had managed care, we had the closure of downsizing the state hospitals. The next thing is efforts to privatize Medicare and Medicaid. And this has been a goal of the conservatives in government for decades and decades. But the way this is done now is by the use of what are Medicare Advantage plans. okay, where people on Medicare can opt into a part of Medicare that's administered by the private insurance industry. And this has, I'm not saying it's all bad, for many people with certain kinds of medical needs, that the Advantage plans can be a huge benefit. But people need to understand them because they, from the point of view of the hospital, for example, a Medicare Advantage plan is often a lot harder to deal with and more likely to deny care than standard Medicare is, and so it's complicated. Now, even less understood than Medicare Advantage is what's called DCE, that means Direct Contracting Entity, and this is basically, whereas Medicare Advantage is being administered by an insurance company, a DCE Medicare is likely to be administered by a hedge fund. They're not even an insurance company, and people don't know this. And even what people really don't know is that Medicare can just transfer an enrollee's plan into a DCE without telling them. So, I mean, people need to know more about this. So we have all of those things that have been happening for a long time. I think they form a trend. The only, or the most important reversal of that was the Affordable Care Act, because with the Affordable Care Act, the government finally did make some demands on the insurance companies, which, although I think it had a lot of flaws, but it eliminated the pre-existing conditions problem, which was a disaster for small businesses and self-insured people all over the country. And also the second big major benefit of the ACA was the subsidies for people to buy their own insurance through the marketplaces. And one of those subsidies are now at risk because, or actually they're more than at risk, they're going to be canceled or cut back with the big beautiful bill, and that will have a major effect. So I can say, speaking to that, in my career, I've known many people from all the way from the beginning over the years who were forced to forego necessary treatments and testing because they were uninsured. And I've personally seen numerous, well, I don't know how many you could call numerous, but enough cases where really bad outcomes resulted directly from that. So I would really hate to see that become worse again if ACA becomes, is made dysfunctional by funding cuts. And even with the Affordable Care Act, there is still a problem. Like, we still see in medical care that people who are foregoing necessary treatments because they have to, they can't afford the large deductibles. And so basically, just to wrap it up, I'm one of these people who believes that healthcare is really a human right, and the government is the only thing that's going to be able to step up and guarantee that right. So,
Here, I agree. Thank you guys for being here tonight. Thank you to the library for hosting. Thank you to Gary for coordinating this. I'm Holly Eaton. I'm the district representative for this area. And when we first started talking about having this conversation, it was to talk about the big beautiful bill, right? And so I coordinated some thoughts, and I'll get to those, but I want to say that since we decided when, we're now into a federal shutdown, and we're on day 6. And I personally applaud the Democrats for keeping the government shut down. I'm really concerned about health insurance, and I'm concerned that if we don't use whatever kind of leverage that we have, millions of Americans are going to be in a position that they're going to be paying lots of money for mediocre health insurance. And that is just a basic principle. It's something that we as Americans and as humans really have the right to have. So now I'll get back to my original written statement. And I think actually this was already kind of said, that we are living in, unprecedented times. And I feel like every time I hear that, I think, oh gosh, yet again, we're living in unprecedented times. But I decided to open with that because for me, it's never felt more true than in the last 5 months, right? 4 months. On June 2nd, my life changed. I was driving to work when I was in a serious car accident in Sedgwick, Maine. I was taken first to Blue Hill Memorial Hospital, which now is essentially like an urgent care. They don't do much. Sorry if anybody loves Blue Hill, but I'm not a big fan these days. And then I was sent to Bangor, where I was waited in the hallway for hours and nobody took care of me. So the background is I was in the motor vehicle accident. My car was totaled, my body was totaled. I broke my back and I wasn't seen literally for 12 hours before someone said, oh, we should get her a room. Oh, we might want to pay attention to her. And so that was early in the week, and then later in that same week, I had a pulmonary embolism, and I was life-flighted to Portland. I share all of that because I have a very different perspective of the medical care and healthcare model that we're living in than I did before June 2nd, because I lived in it for 3 weeks, and I am now here, able to sit here because I and my family, I'm a single mom, and I have 2 children, and would qualify for main care. And if I did not qualify for main care, we would be broke, we would be homeless, everything would have been taken from us because health insurance costs so much money. And so it's one of those times that I'm thankful that we live below a poverty line, and I was able to qualify for main care, which I am a staunch advocate for. So anyway, I will fast forward to kind of looping that in. I share that because I've had calls from people who are trying to figure out how they're going to afford food, rent, and heat this winter, especially with the changes that we're seeing in SNAP benefits. Those cuts in work requirements expansions have already begun, and that was mentioned earlier. Now people who qualify for SNAP benefits are being asked to prove that they have applied for work or that they are working. And a lot of those requirements just kind of slid in. A lot of the people that I'm talking to had no idea that those changes were coming, and they have not been communicated with. They go to the grocery store to try to buy something, and they find out that what they thought they were going to get allocated, they were not allocated. So we're seeing some of these big, beautiful bill stipulations come in really quickly, and some of the other ones we're not going to see for months or until after the 2026 election cycle. And so I'm trying to go a little faster because I know we've been talking a lot. So I started by explaining what I lived through, but something like what I went through could be completely devastating to my family, but to any other family that maybe didn't have main care or will not be eligible to buy insurance this year. Next year they'll be living without insurance. And if they have a motor vehicle accident, what kind of situation are they going to be in? So many people are living in a situation that they are one crisis away from being homeless, from not having food, from losing their homes. All the list goes on. And being in a position that I feel like I lived through a lot of that, it's very eye-opening, and it makes me feel very impassioned to make sure that at whatever level I possibly can impact and make change for our district, the state of Maine in particular, I want to make sure that I'm able to do those things. And I think the rest of what I've got here is kind of self-explanatory. These are unprecedented times, and I hate that cliche. It sounds so like we hear it over and over again. But I think that because we're having conversations like this, and we're coming to the table, and we're sharing what we're concerned about, and what our strengths are, and how we can work together as neighbors and as Mainers, that's where we're going to be able to get to a point that we can get through these tough times, and hopefully, working together, we can get to a better point in 2026, 2027. So I will end by saying, pay attention to the campaigns that are going on, to what's happening at the state level and at the federal level, because you will be called upon to vote, and it's really important that you know where people stand and how they're going to fight for you, because it's really important that we have the best people at the table for our Mainers. Thank you.
Thank you all very much. As you prepare your questions, I don't know if we have nobody yet online. We do have until about 6:30 if we want to take that much time. I know it's advertised till 6, but you're all ready to be here till 6:30. One question that comes to mind listening to you, and you gave us a mixture of, here's the reality and here's some hope. Is there state legislation coming up that provides you with some hope? And that's for everybody, including, medical, on the medical front, on the food front.
Well, I would say that that's a great question, and it's, to me, that question is the most important one as we face going into the second session, a short session. We're a very part-time legislature. In the even in the odd years, 2025, we met from January through June, and in the even years, in 26, we meet from January till April. So the short session is considered to be a time where emergency bills are brought up, where the governor can propose anything, and supplemental budget issues will be discussed. Because we have to do with the budget, the opportunities that we have, I think, are in healthcare to put additional funds into supporting Mainers, and to keep our, especially in rural areas, to keep our health centers and our hospitals going. There are many that are in danger of being closed, and if people don't have the wherewithal to seek the medical attention they need, that will draw millions of dollars out of those health centers and hospitals, and what the effect of the lack of affordable care support for the premiums will do is people will drop that care, and they will end up, when things get dire, going to an emergency room. And May law requires that hospitals do not turn away anyone. That's called charity care. MDI Hospital, for example, provides $2 million worth of charity care per year. And I think the only thing that keeps MDI Hospital afloat is the generous donor base. If we didn't have that, they would be in danger of closing more of the services like they just did with the OB unit. The other thing I think we can do in the budget is put in money for food programs. The federal government, as you heard, cut many aspects of support for food, and I would like to see that in the budget. I think it's going to be a fight because the budget is tight, and the only way that we can fund those things is by raising progressive taxes on those that are able to afford it. Tax fairness. So that's my answer to that question. Holly looks like want to add.
Yeah, Gary ended on a really positive note. I think we're lucky in this area that we have Gary and we have Nicole Grahowski, who's your senator, who sit on taxation, and so to follow in this next session what we're able to do with some of those bills is going to be really crucial. I will share that we just received the list of what bills may be considered this morning, and so I kind of briefly went through them, honestly, to see where my one bill was going. But I know of another bill that okay. But I wanted to share that there is another bill that my legislative colleague, Representative Annie Graham, has submitted, and that's to put a pause on closing the labor and delivery units in hospitals across Maine until we can do, I don't know if it'll end up being a study or what it will look like, but it's essentially to say, look, can we please stop closing these delivery units, these labor and delivery units? And I feel like that is crucial. We're seeing those closures across the state. We've seen it here, we've seen it in so many other rural communities. It is critical. We need to do whatever we can to put a pause on those and stop those closures. And then to Gary's point, it is a short session, so that means we'll only be in session January through April. And it is critical to pay attention to what the budget looks like and what we can fight for, essentially, to keep in or to put in to protect our Mainers and see where those gaps are. So again, this is another reason it's great to have these conversations so that when we go back in January, we know what's important to you and what gaps we need to be fighting for, because it's going to be so much bigger than any other gaps we've seen in recent years. So.
Okay, thank you very much. Are there any questions from anyone in the room at this point?
It's just an overall question, and it's probably beyond the scope of what you're talking about today, but, what if we've already crossed the line? I was in Romania in April,
Could you
and
hold it closer to your mouth?
Sure.
So online we can't hear.
many of the people in Romania said, you're already crossed the line. You need to come up with a plan B that doesn't mean looking to your federal government and Congress to solve your problems. It's got to come from the community. And I think maybe all of us are a little bit, I don't want to use the word frustrated, but, what can we do besides write to our senators and Congress people who apparently don't listen or feel they can't? So I don't know if that group of you can respond to any of that.
I'll respond. I think there are several things you can do. I think that citizens need to keep the pressure on, particularly for Senator Collins. She needs to hear from you that you don't want to see the Affordable Care Act cut the way that it's currently written. That's why we have a federal shutdown right now. Is the Democrats drew the line on that, and they said, we're not going to pass a budget bill until you restore the health care provisions that were put in place in the Biden administration and in the Obama administration. I think that you can stay in touch with the governor. I think you can pretty much count on Holly and me to support progressive tax bills that will be coming from my committee on tax. But the governor needs to hear from you. I think that she needs to hear on all those bills that are in the back of that newsletter printout that I gave you. I do believe that all politicians are sensitive to what they hear from the public, and especially if Governor Mills is running for Senate, which by all accounts it appears to be the case, she's going to be extremely vulnerable if she does not agree to keep our healthcare system intact. If under her administration, hospitals and healthcare centers start to close, I think that's going to be a real black eye for her. And so I think she'll respond if enough people speak up. We're a very small state, and all politicians are extremely responsive to hearing from their constituents.
I'll just add, I think there are a lot of ways on the food side. The local organizations in your communities need your help right now, and that there are opportunities to get involved, volunteering, financially, if you're in a position to give to your local food pantry or another organization that you feel passionately about, or if you have friends who are in a position to give, to encourage them to do so. I don't think that it's right that we're in this situation, and it shouldn't be, the government is shirking its responsibilities when it comes to funding these initiatives. But the reality is that people are really hurting and going to be in even worse positions going into the winter time. So if you're in a position to support local food access efforts, I strongly encourage you to do so.
I just want to say, I agree with you, 100%. I don't have friends in Romania, but I have dear friends in Canada, and I've had the same sort of feedback that are saying your national or federal level is done. What are you going to do in your local communities? And I think it's not a direct answer, but that's where this kind of conversation is so critical. And the fact that we do have a state legislature, we do have the state of Maine government that are working really hard and diligently to try to support our Mainers. That's what we can actually control. Unfortunately, we have no control over the federal level. But it is, as Gary said, it is critical that we make those phone calls. Who knows if Senator Collins actually hears them or cares, but it makes you feel better, and that's medicine.
One of our questions from the audience, I didn't hear this, but apparently Governor Mills today said that Maine will not enact the big bad bill for Maine taxes. Are you familiar with that? Okay. What is the impact? Usually state taxes are based on federal taxes. How will this work?
What she's talking about is what we call tax conformity in the Taxation Committee. Maine income taxes are based on, they start with your adjusted gross income, which comes from your federal Form 1040. So anytime Congress makes changes to the tax law, that's going to have an impact on Maine. In this case, there's many cuts. And what the governor said is that she's going to conform with the big, beautiful bill, so-called, I hate that term, I call it big bad bill. She's going to conform with those where they are very small changes. It'll make it easier for taxpayers to fill out their forms, knowing that the small things are going to be accepted. And that's just a few $1 million in terms of its hit on Maine revenues. Then there are a whole bunch of provisions that will cost tens of millions of dollars. And that's why our Taxation Committee is being called back into session a week from Friday to look at all those and decide whether we should conform to any of them. At this point, I think there's a lot of feeling not to, because Maine just can't afford it. But it comes out to about a dozen different issues that I'd be happy to talk to you in more detail about at the end of the session today.
Okay, we have a couple, I'll take in the back first.
Classically, food security has been funded by a vertical system. So I'm wondering about the ideas of going to a lateral system such as food co-ops. Just what do you think about that? Being able, because the vertical system always obviously has been cut from the top, and it's not happening. And that we've been dependent on that for so long because it worked. Now we know that. So I'm wondering if we're taking so much time fighting that vertical model, how about looking at lateral models like food co-ops, which food co-ops are lateral models in communities when it comes to food security.
I can start. I love co-ops. I was part of an effort to try to start a storefront co-op in Bar Harbor. I don't know if any of you remember that effort back in the day, and was originally how I got involved with Healthy Acadia in the first place. And so I don't have too much to say specifically on co-ops, but it does bring to mind some of the work that Healthy Acadia and other organizations are doing, which is very cooperative in nature. So working in partnership, collaborating across the food system. So for example, in our gleaning initiative, we are working with dozens of farms across the region to collect food that would otherwise be going to waste. So we're working in ways that are outside of the traditional food system, and working to capture perfectly good produce and distribute it to food pantries and community meal sites and other food access points in our communities. And there are organizations like us across the state that are doing similar and really exciting innovative work. One of the things that I love about doing this work in Maine is that it is so highly collaborative, and the organizations are, it's very rare to see competition or animosity between organizations that are doing this type of work. Like, people are really in it for the common good and to do the work that's in service to our communities and our farmers and the people who need the food. So I don't know if that exactly gets at what you're talking about, but it certainly is part of what's inspiring me about the work that we're doing.
I can tell you there's an effort in Southwest Harbor that started already. It's already started a month ago. And the principals in that are the president of the chamber and the town manager. And that's Holly Masterson and Karen, I don't remember her last name. But that is an active thing right now.
Great. And is that to start is that a cooperative effort, or?
To start an actual food co-op here, Southwest Harbor, based around seafood, so that we can bring the fishermen and lobstermen in to support it and use it, and then out from there.
That's really exciting.
I just wanted to say anecdotally, likewise in like 2008, 2010, something like that, I worked for Maine Center for Coastal Fisheries, and we did a CSF, so a community-supported fishery program. So I applaud that effort. I think it's very forward-thinking. But I'd love to learn what the model looks like and how they're hoping to implement it, because there end up being some pitfalls, right, when you try to do something like that. So it's very exciting. Thank you for sharing that.
Well, the president of Chamber of Commerce is Holly Masterson.
Yep.
And she knows everything about the seafood industry here. She's been a big part of it. And that's her heart in that's going to start from there. And she thinks that she can bring all these people together to create that.
Thank
No
you.
doubt. Thank you very much. We'll go to,
Thank you for doing this. I have a comment and a question. My first comment is that Dr. Mark has written some articles for the online portal Medium, and everybody should have a look at those and share them, because you know there's a lot of disinformation out there on social media, and if we could share the good things that are being said and done, it's a good idea. So Mark Kandich on Medium. I think there may be a paywall, but not sure. My second, I have a question for Holly. Katie, I'm sorry. Katie. So Healthy Acadia is an umbrella organization for a lot of food bank. I'm trying to get a handle on what you guys are.
I know it can be confusing, and we do a lot of different things. We're not an umbrella organization for food banks, so the Good Shepherd Food Bank operates at a statewide level. They distribute food to food pantries all across the state. We are a partner organization, so speaking about our food programs specifically, we help to bring together partners across both Hancock and Washington Counties, so we convene networks that meet quarterly, food security networks in each county. So we're sort of a convener. We bring people together to have conversation, to share resources, collectively advocate, those kinds of things. And then we also implement initiatives like the Gleaning Initiative that I mentioned. We have staff on our team that are going out to farms and collecting food and distributing it to food pantries. So we're sort of like operating as like a little mini food bank of rescued food in a way to our local organizations. We also we operate 2 farms in Washington County as well. One is called Down East Restorative Harvest, which is a community corrections farm in Machias. So that is a new initiative as of the past couple of years, growing food that we're growing food on county-owned land. That food is going to the Washington County Jail and to food pantries in the county as well. And we're also partnering with the jail and the Department of Corrections on initiatives to engage prison and jail residents in that space and educational opportunities around horticulture. And then Folklore Farm is a farm in Cherryfield that we operate as a food bank farm newly, just as of this year. This is a new project. It's an existing farm that approached us and was interested in joining forces and growing food for food security purposes. So we've kind of brought them under our umbrella. We do a few other things as well. I mentioned the SNAP Ed program. That was a huge part of our Food for All program that is unfortunately going away. And we also have a healthy eating, active living initiative that works with schools and childcare to help them connect with healthy food, opportunities for physical activity, change their policies, environments to help kids be healthier, and things like that. So we do a lot. I encourage you to visit our website. It's all there, but it can be a lot to keep track of. And if you have any other specific questions about Healthy Acadia, I'd be happy to answer them.
I'm going to mix in one. Oh, I didn't want to jump in. I'm just going to bring a question in from the audience by card, and if folks, you still time to write a question on the card, give it to Alex, or we just raise it, and Alex will grab it. But this is for the representatives. In terms of education, Southwest Harbor's largest budget area is education, like many municipalities. We are considered a minimum receivership in the eyes of Maine's Department of Ed. If the funding model could include affordability for our residents, we could help reduce our property tax burden. That's a comment, if you care to react to it.
I would just say that I have had a similar comment from both Stonington and Deer Isles town managers. It's a huge issue, and I'll defer to Gary since he's on the tax committee.
Thanks for the question. Right now, there's a property tax task force comprised of legislators, people from the administration, and people representing municipalities and different points of view from around the state. And your state senator, Nicole Grahowski, is the co-chair of that task force. And we know that property taxes are out of control in most municipalities in Maine. They're increasing by often double digits year to year, and it's just simply unaffordable. Coastal communities are particularly vulnerable because the revenue sharing from the state's based on what they consider ability to pay. So if you have a really high valuation community, then you're going to get less money for that. I'd also say that there are a lot of good ideas for reducing property taxes, and we looked at more than a dozen bills this session in tax, and we decided to kind of roll all those questions into the task force so that we could address that comprehensively in the next session. I think, does that answer? Oh, good, thank you. Another bill that I have been working on is a local option lodging tax, and most coastal communities have very high volumes of short-term rentals, Airbnb, VRBO type things, as well as hotels and B&Bs. And that bill would bring in hundreds of thousands of dollars to the towns on MDI per year. I was proposing a 2% local option lodging tax, which means that the local town would have the option of voting it in. It's not just a across the board tax, but I think that is one way to get our visitors to pay the costs of providing the infrastructure that they enjoy when they are here. So it only failed by 4 votes in the legislature in June, and we have ideas about how to turn that around in the next session.
I was wondering if you could comment on how the shutdown or administration policies are impacting K-12 education or in higher ed here in Maine, or how you anticipate it might going forward with funding gaps, and then is there anything we need to do at the state or local level to fill those?
I wish I had.
Yeah, a lot of the like special ed and other programs that have been funded by the feds are in danger. We don't exactly know what's going to happen with the U.S. Department of Education. The administration is trying to dismantle it, and the things that we're getting from them are ideas for curriculum that would involve kind of a Christian bent and anti everything else. Fortunately in Maine, we have home rule for education, and school districts, school boards can decide what the curriculum is. But we're going to be getting less help from the feds on education, and it's a real problem in Maine because the cost of education is skyrocketing. Like, we know that Southwest Harbor has one of the highest per pupil costs in the state, only beat by Fremont by a little bit. And so we have small schools with diminishing populations. You still have to have the same administration and number of teachers and upkeep of buildings. Right now, of course, on MDI, we're exploring forming a unified school district. That, I think, is a good idea. I think any kind of consolidation is a good idea. I served on the town council in Bar Harbor for 12 years, and I can tell you that the best thing that we ever did in terms of cooperation with other towns is to combine our police department with Mount Desert. And that provided much better service at the same cost. We didn't save money, but we got way better service, way better morale in the police force. And I think anything that we can do to consolidate our schools, especially in the face of shrinking populations, is critical. I just want to make one more comment because I've lived in Bar Harbor almost 45 years, and I've seen our school shrink in population in a downward trend that's really startling. And the town of Bar Harbor voters decided to spend $60 million on a new school. If you drive Eagle Lake Road anytime, take a look at that building. It's kind of stunning, and I think shocking that we would put $60 million into a new school and we're not doing anything for affordable housing. You know, where do the teachers going to live? They can't afford to live here. And look at where our school children are going. Families are leaving MDI because they can't afford to live here anymore. So, housing is a much more difficult issue to tackle than education. It's like, if the roof's leaking on your school, you say, oh, well, we should build a new school. But the housing population, the housing crisis is more invisible. We don't see it. But I'm mostly concerned that we're gutting our local populations by turning our housing stock over to short-term rentals and worker employee housing for summer businesses. Bar Harbor is the only town on the island that had the guts to institute a short-term rental ordinance. We have a cap on the number of non-hosted vacation rentals. It means you can't be an investor and buy up homes all over our town anymore just to rent them out by the day or the week in the summer. Southwest Harbor didn't have the guts to do it. Freedman didn't have the guts to do it. Northeast Harbor and Mount Desert didn't have the guts to do it. I think and Southwest Harbor I think the population here is close to verging on the edge of collapsing because local people can't afford to live here anymore. So in my mind, that's one of the biggest issues we have to face. It's a tough one to deal with in the legislature, but we can do more. We did institute a new real estate transfer tax that passed this session. It's a 0.5% tax on real estate sales over $1 million that goes into the Maine State Housing Fund, which is a good start. It's not nearly enough money to address what needs to be done in terms of housing. And I think every one of our communities has to look at it. And I'm afraid that we're being overwhelmed by greed, by people thinking that they should be able to do whatever they want with their property because it's their asset. And if they want to get the highest value by turning it into short-term rental, that's their decision. But I think at some point we have to, as communities, say, when is enough enough? And then the last thing I did on town council was make sure we passed a moratorium on transient accommodations because I didn't want to see our town be turned into hotels everywhere and B&Bs. So I think those are things that we can do at the community level. is to say, no, we're not going to let our communities erode any further. We're going to say no to short-term rentals and transient accommodations, and say yes to figuring out how to build more housing that's affordable for the working people that need to be living here on the island.
Excuse me. Can you speak to the word that you used? You used the word collapse. I live in Southwest Harbor. Can you define what you mean by collapse? That's a very strong word.
Yeah, I mean, look at Pemberton School. Look at the population they have there. You know, that there are less and less families that can afford to stay in Southwest Harbor, and at some point, you know.
I understand that.
Yes.
My daughter went to school here.
Yeah.
You know, very valuable school.
Yes.
The reason why she is where she is right now, which she works for Greenbacker, okay? And I got a lot of news from her today about the challenges they have right now, as well as Copenhagen Infrastructure Partners, who are moving out of this area and going straight to Europe. They do the same thing. But the value of that school, to me, is very high, you know? I've been in business here. I know this community very well. I understand what you're saying. Right now, we have, Southwest Harbor has a food desert, what I would define as a food desert. I've studied it all summer. And there are a lot of factors to it, but they're not reversible at all. I mean, they are reversible. They're not going to be constant. The word collapse really, it shocks me that you would say that. You're defining something with a word that, to me,
Yeah, you raised the food co-op as a solution, which is a great positive way forward. But if you want to briefly address that, we can do a bunch of other questions.
I'll just say that as long as you put a value on residential property based on the income that you can generate from a short-term rental, you're going to drive out working people. They can't afford those prices. And until the community is ready to say, no more short-term rentals, you're going to find your housing stock declining, because it'll be all summer residents and short-term rental owners. And
Airbnb has caused a lot of trouble here.
Okay.
I know the inn owners.
Let's bring more people into the conversation. Thank you very much.
I have a question, but I also have a comment. And so my question for you is about housing, and how are things that are going on in the federal government going to affect what the states get and what the states can do for housing in communities like ours. I would also like to say that Southwest Harbor has not just rolled over and played dead. We have completed an inventory that is far more detailed than anything that has happened in either Mount Desert or Tremont, because we feel we need the facts, the data about what's going on. And this is about to be made public this week or next week, assuming that we end up on the select board agenda. But it is certainly short-term rentals are an issue, and the number of people who are in town for very short periods of time have a number of effects on the community. But we felt that the town and the select board felt that it was important to understand exactly what the situation was, so that we can now move forward to community discussions about people's concerns and talk about policy and what we need to do moving forward.
Yeah, folks, feel free to come and go as you please. We're going to advertise till 6 and it's public. It's kind of casual. I'll get to this question. Yeah, we have a question online, kind of follows to some of this discussion. Are there ways for our select boards and town councils and county government to engage and provide action or leadership on any ways to address human needs in our communities? And this is would apply to healthcare, food insecurity, everything that we've been talking about.
I talked too much. You should say
I
something.
mean, I would just, I think we just had a fine example of how that's already happening in Southwest Harbor. And I know more locally for me, Deer Island, Stonington, those kinds of conversations are happening. I think they're happening in some of the outer islands that I represent. It's really important that we have really, really local community conversations on how we can collaborate and work with each other. And I think that's exactly what that question is getting at.
We'll take one or two more questions and we'll wrap it up.
We got a question over here.
We have one first, sorry, and then if that's okay. Where's the question? Okay, in front of you.
One of the things that I want to find out is if there's any way that we can have this state legislature and look into the general assistance program, because to be honest, it doesn't work. I've had to try to use it a couple of times, and it's just my wife and I, and we're both disabled, and we barely get anything on disability. My disability is based off of what I earned in the 80s, and I figure that it's 65% of what you earned, and at that time, so I'm not even getting $1,100 a month. But yet, when I went in, because my Social Security this year has been so screwed up ever since Doge got into the Social Security office, I went into the city office here to apply for some general assistance, because we're facing eviction. And we were told that because it is my wife and I, and she gets SSI, I get disability and SSI, that we make too much to get general assistance. And basically I asked her, well, what's the case? And she's like, well, if you have an income an official income of more than $600 a month, you don't qualify for general assistance if you don't have any children. I'm like, who can live on $600? So, I mean, the general assistance program, I really think, really needs to be looked at. And if there's any possibility of having it looked at. The other thing is, some of the rules on the public housing situation are just downright ridiculous. It's like we're being punished for being poor. We're not allowed to have our own gardens. We can't grow, we can get seeds on food stamps, but the housing authority's rules are that we cannot grow our own food on the housing authority property.
Some people do it anyway, but they're, then with every now and then the housing authority will come along and grab it and throw it in the dumpster.
The housing authority only has 2 people covering maintenance in 17 buildings. And we had a bathtub that blew out, and there was a 3-foot by 4-foot hole in the ceiling in our living room for almost 6 months because they didn't have anyone to come in and fix it.
Thank you. Yeah, this is so indicative of the punching down mentality that's happening at the federal level. Do you have any thoughts on how we can reverse, that and provide more support for general assistance and community housing?
There is one other thing I wanted to mention about this.
Okay,
I think
go quick, please. Yeah.
Another part of housing is we're not allowed to have any assets, and life insurance counts as an asset. I'm 60 years old. I've got a lot of things going on with me. My wife, Dana, has been disabled all her life. So she doesn't qualify for Medicare or disability or anything. If something happens to me, she will have to try to live off of SSI alone, because they're, and main care, because since she's been disabled all her life, she doesn't qualify for anything. So, but yet, living in public housing, I'm not allowed to have life insurance to try to cover it for her.
Just so your points don't go unnoticed, I want to say that I have family that are in a very similar situation to you. It's very frustrating. It's very indicative of how the system is set up to keep people in a certain position, and that doesn't allow people to move forward. It doesn't allow people to have that safety net that you're talking about, and that's really crucial. It's really important, no matter whether or not you have children, you don't have children, you're living alone, you're living with a partner. You need to be able to have that sort of safety net set up. And I just wanted to say that I hear what you're saying, and I don't think that I have an answer, but I really appreciate you bringing those
Like I
points
said,
down.
just have the legislature look at general assistance and
you've heard, yeah, the representatives have heard it for sure.
Yeah.
I think that we should get your name and number and look into it, because I'd like to find out more. I know that there are income requirements, but it seems like in your case, there might be other avenues of support. So that's the kind of thing that we can look into for you if you want to share your contact information.
Yeah, thanks so much for coming and saying that. We had one question in the back, and I'm afraid we're gonna have to, oh, you've been raising your hand from the beginning, haven't you? You, and then in the back, and then we'll call it good.
Thank you. I have a question about Governor Mills. You said she said that she wasn't going to vote, wasn't going to vote for property tax increases, and so she's been the reason this tax that you were looking into, and the tax for multimillionaires, is she the one that's been putting the hold on that, the kibosh on that?
Yeah. She pledged no new taxes when she ran for governor 7 years ago, and so she's against any increase in state taxes. Property taxes are a whole different, that's controlled by your municipality, but she's the one that we've got to get through, because if we pass a bill in the state legislature, it goes to her desk, and she can sign it into law, or she can veto it, or she can do nothing and it will go into law by itself. She's the one that we have to fight to try to take back some of the big tax cuts that the big beautiful bill bestowed on the wealthiest.
So she needs to hear from us.
Yes.
Exactly.
So I have to talk to you about actually what we're supposed to say.
Okay, sure. Hope you have to.
Then in the back, you had your hand earlier, have someone in the back? No?
I went already, yeah.
Oh, you went,
Okay, good.
okay, thank you.
Gary, looking at this paperwork about the rather staggering proposed premium increases for the Affordable Care Act under the exchanges, do you have a sense of what the impact will be on those of us who are on Medicare, or not through the Affordable Care Act, just straight old Medicare?
Medicare is not slated for cuts at this moment, although.
Well, not worried about cuts, worried about increases in premiums. Like, they're talking here about over in some cases, $12,000, $20,000 increase in premiums.
Yeah, that's for the Advantage, excuse me, that's for the Obamacare
Right.
plans,
We're
not
aware
the
of
Advantage
exchanges.
plans.
But what about straight old Medicare?
Yeah, well,
Medicare Part B, for example.
well, I think the challenge for anyone that's paying premiums into a private plan is that the cost of healthcare in Maine is increasing so dramatically right now that those costs are going to have to be passed on to someone. And the biggest payer right now is the federal government. The second biggest is the state of Maine. And then all the private insurers are going to have to raise their rates to deal with the huge spikes in pharmaceuticals and other medical procedures that are causing them to put the squeeze on. The other thing is that private insurance companies typically squeeze around 20% off the top for profit. And you know, I think that's what's at the heart of the Northern Lights anthem standoff right now. How much those private companies are making, but as long as private insurers are in the game, we're going to be paying more than just about any other civilized country on earth for healthcare.
It's not reassuring.
All right, I'm going to wrap it up here as we approach the bottom of the hour. And I want to thank our panelists here so much for coming to Southwest Harbor and talking about these vital issues. I want to thank the library staff, Kate, for running the Zoom and audio here, and to Nancy and Alex. Nancy's done a huge amount of organizing for this event. I'm really grateful you made it easy for me as a moderator. I think we've heard a lot here, we've learned a lot from each other. We've learned this is not only a federal threat, we also have threats from the state government and some of the policies that are coming there. There's a lot of the tax issues. But we heard some messages of hope here, and that's what I will carry from here. We heard about the Farm to Neighbor program. We heard what MOFCA is doing. We learned about this seafood co-op program in Southwest Harbor that's in formation. It's terrific. Main care, we still have main care. We still have our school boards. We still have our select boards and town councils. We have local control. We still have that. We still have each other, neighbor to neighbor, helping each other out as we've done for centuries here. You're all being here and online gives me hope going forward. So thank you all for coming and having a great discussion. Thanks.